Thanks, Minister, and good morning. Certainly it's been gratifying to have 3 of the 5 new cases effectively in quarantine during their entire infectious period, so minimal, if any, new exposure sites listed for them. The 2 new cases who have not been identified as primary close contacts previously do have that, again, link to Craigieburn Shopping Centre and Epping Plaza Shopping Centre. They were frequent attendees at both of those sites. We haven't got a definitive crossover time with known cases, but they did get tested, or at least one of them was prompted to get tested because they saw that we had concerns about those settings as potentially at risk for people who pass and have casual contact with others. So it's really just not to overemphasise these sites, but to say that it does become a challenge if people aren't aware that they're a primary close contact, and so there'll be some exposure sites for these individuals because they weren't quarantining already. But it has flagged that you should look at all of the exposure sites that are listed and not just reflect on the specific times and days for those exposure sites, but if you're a frequent attendee of some of those shopping centres in particular and you don't know the exact times and dates that you might have been there, that you should think about getting tested, and certainly if you're symptomatic, to get tested. And to see over 35,000 tests today, that testing remains extremely strong. That's probably half of all symptomatic Melburnians on any one day. So having that number tested every single day really does help us identify any potential coronavirus cases that are out there. That's a really strong performance. The only other thing I'd like to talk about today, I do understand there might be some anti-vax protests planned for today. It's hugely unfortunate that there's that sentiment in anyone. I think they represent a really small minority. And I should say the vaccine is not mandated. So as an individual, you're free not to get it if you don't want to get it for yourself. I still find, some discomfort with that because we're all going to be protected with high vaccination coverage. But it is your choice. But do not get in the way of all of those Victorians who are trying to come and get vaccinated today and every day. Record numbers again for Victoria. And those are Victorians who understand that it's protecting yourself. It's certainly helping to protect your immediate family. Those who can get vaccinated in addition will be protected, but those who are too young to be vaccinated or those who are otherwise unable to be vaccinated right now, they will also have the relative protection of you getting the vaccine. And Victorians understand that. And then there's the broader vaccination coverage that will just help us get to that safety zone that we are desperately looking for in Victoria, in Australia, of very high vaccination coverage for everyone that just suppresses the virus ongoing. It is a race because we need to get to that safety zone as fast as we possibly can. The greater numbers that come through every day, the faster that we'll get there, obviously. So all I would say is please let those who are motivated with a very positive intent to get vaccinated do so freely and safely. Thank you. I'll let Professor Lewin speak just about some of the variants and the work of the Doherty Institute in relation to the sequencing done for that.